Welcome to today's session. Today we'll be practicing a development station. Initially, we will be practicing a whole scenario, and then we'll be discussing whatever questions, queries that you guys have. And obviously, if you come up with any questions, any comments in between, you can always message in the chat box. I hope most of you are those who have got the seats in the exam and are already prepared, are already preparing for the exam. And most of you know that how the development session goes, how it works. But maybe someone new has joined in today who has like just started the preparations for a recap. Development station is the largest, is like the most having the most marks. The development station is the one which has most of the score. It is the station having 12 marks, which means that there's a big chunk of marks in your exam that goes into the station. And if you practice this, if you master this station really well, you secure these 12 marks, because if you do it right, you do get proper marks, 12 marks in the station. So if you get it right, then you have a good secure position in your exams, and you have a good margin of not performing very well in the other stations, right? So it's a 22-minute station. First, when you are waiting outside, like every other station, when you're waiting outside, you are given a sheet in which a command is being given. You will be told that what task you have to do, and it will be told that the age of the child and whatever the issue is. What you can do outside is to have a journal idea of how you're going into the station and what DDs, whatever things you have in your mind. Once you go inside the station for the initial 9 minutes, you have to take the history. It's it's written that it should be a focus history. It should not be like detailed like the other history station in which you take the history of 13 minutes. In this you take history for 9 minutes, and after 9 minutes you are given 1 minute to summarize your findings, right? So after you have summarized those findings, whatever you take in the history, you will be asked to do the examination. So now the scenario is that the patients are present in the other clinical stations, but development is not face to face. It is the role play. The history that you take is with the role player. After that, the role player goes out. You give a summary in a minute, and after giving the summary in a minute, you uh, face the examiner, and examiner tells you. So you're basically going to narrate all the examination that you would practically do if you were with a child. So you're not demonstrating it right on the child, you are just narrating it. I think I personally feel that it's a bit easier, because obviously when there's a child, then you have to take a lot of things in consideration. Then in those 9 minutes, you do your assessment. If it could be a single assessment of one domain, it could be assessment of more than one domain. And after doing the assessment, you will tell your findings. So that counts for your 9 minutes by doing the assessment and telling your assessment. And then in the last 3 minutes that are left, there is going to be a discussion from the examiner, in which she is going to ask about the differential causes of the delay, and investigations and the typical management plan, right? This is how the station goes on. Um, we have a volunteer for today. I think Dr. Umar is going to participate today. Dr. Umar, are you here?
Dr. Rahman.
Oh, okay, sorry. Dr. Rahman, sorry. Yeah, Dr. Rahman.
Yeah,
Dr.
I'm
Rahman,
here.
Hi, can you hear me?
Yeah, I can hear you, Dr. Iqra.
Okay. Okay. Okay, I'll give you the station, and you have 3 minutes to prepare for that. And after that, we'll start and we'll follow the exact timings, right?
Okay.
Okay. Okay. This is your station. You have 3 minutes. Meanwhile, if anyone else has any question, feel free to write them in the chat box. Also, when we are going to do the history and we are going to practice it, uh, s- some of you can like take down notes, and maybe by the end we can ask someone else to add like the summary and maybe some other things as well. So we can involve the participants as well. So just um, be active and during the hearing and make your own notes as well. Okay, so the time's up. Let me start the timer.
Okay.
Okay, start.
Good afternoon, Mrs. Mona.
Good afternoon, doctor.
I'm Dr. Misa. I'll be taking some notes regarding Raza's health. Is that all right?
Yes, that's fine.
Okay. I'm going to note down some points as well, okay?
Yeah, that's okay.
Okay. So please, can you elaborate what the main concern is?
Yeah, I started sending him Raza to nursery recently, and I feel that like he's not like his other kids that are at nursery. And I mean, he didn't really used to play much at home, but I was hoping that if he goes to nursery, he might play well and do certain things. But the teachers, like the caretaker, they also say that he doesn't do things well. So I wanted to have an evaluation for that.
I can understand you must be really worried for him. Can you please tell me when did you start noticing it?
I mean, if I tell you that he always had some issues going on, so I knew that he was a bit slow in everything. But I wasn't
Mm-hmm.
concerned till I sent him to nursery maybe 3 months back.
Okay. And is there anything that he could do previously now he can't do?
I don't think so, no. He's just been slow.
Okay. And what about other aspects of his development, like walking, talking, and everything?
Regarding walking, yeah, he walked a little late because you see that he had other issues as well. He has been having fits since like 1.5 year of age. So I thought that maybe it's due to that he has some issues. So now he can walk, but like it's different from the other kids as well.
Okay, I can understand that. I'm going to come back to that. Can you tell me, is there any history of fever?
Right now,
With the fits or
look, the fits have been going on since last 1.5 year. At times there is fever, at times there's no fever.
okay. Can you tell me about his growth? His height and weight are they appropriate?
He looks a bit small to me.
Okay. What about his head?
What head doctor?
Is it does it appear normal? Is it a bit large or small? Has our GP pointed out anything?
I think it's okay. No,
Okay,
the
that's great.
no, no.
Okay. Can you please tell me, does he look like you or his daddy?
I think it's a mix of both. I can't really point out.
Okay, that's great. And is there any rash or any discoloration on his body?
Yeah, he has this red rash on his face since birth.
Okay, I can understand that. And what about his hearing? Is that normal?
Yeah, he hears fine.
Okay, what about his vision?
He has issues with vision. because once something went wrong with his eye, doctor says something, his pressure has gone a lot, and then he had some kind of a bit of surgery, and after that he wears glasses. So he has decreased, like I think vision in on one side,
Left or right?
on the right side.
Okay. And can you tell me what about his behavior? Is he interacting like normal peers of his age?
He's fine. I mean, he's a bit picky, he's a bit choosy, and quite a moody child. But
O-
yeah, he's okay.
Okay. And any trauma to the head or back?
What kind of trauma?
He hurt himself or he fell down, anything like that?
Uh, Recently, no.
Okay. Can you tell me about his birth?
Uh, yeah, birth was okay. The pregnancy was fine, but at the end, I had to go through the emergency cesarean section because the doctor said that the baby's heartbeat is getting slow.
Okay. And what was your age when you had him?
What was what? Sorry?
Your age when you had him?
My age, yeah, I was 25.
Okay. And I'm sorry to ask you this, but were you using any drugs at that time? Any alcohol or anything?
Oh, no, no, doctor, why would I take drugs during
That's
pregnancy?
great. That's great. And any blood pressure, sugar, or any rash at that time?
I don't remember that. I think it was everything was okay.
That's great. And did he cry on time?
No, I think he cried a bit late because the doctor said that because he had low heartbeats. I think after that they had to give him some oxygen, and he
Mm-hmm.
remained admitted for a day or so.
Okay. And was he discharged when he was feeding fine? When he was discharged?
Yeah, he developed feeding like after a day or two, I think, and then we were discharged.
Okay. And was the screening of hearing and heel prick done at that time?
Yes, it was okay.
Okay. Any history of transfusions?
No.
Okay. And you said that right now there's no trauma. Any history of trauma at any other
Three
time?
minutes, 3 minutes left. No, no
Any
significant
teams he's
history of trauma.
in follow-up with?
Yeah, a follow-up of the brain doctor because I told you he has fit,
Yeah.
and
Okay.
other than that, and some he took like physiotherapy sessions in between as well.
Okay. That's great. Can he climb up and down the stairs?
No,
Can he
he has difficulty in that.
can he go up at least?
With support he can, but
Okay.
not individually.
Okay. Can he walk?
He can walk, yes.
Can he run?
Not properly.
Okay. Can he walk backwards?
No.
Okay. Can he? How many steps orders can he follow? One two-step order, two steps orders.
I think he can follow two-step properly.
Okay. And how many parts of a body can he name?
Can he name? I think he can name 3 to 4 body parts.
Okay, that's great. And does he know about his name, age, and sex?
He responds to his name. I'm not sure
Okay.
that he did it well, and he can
And
say
what
it.
about okay? And what about sentences? How many sentences can he make?
Or he just speaks a few words, not
Okay.
sentences.
Okay. Can you describe your family for me?
Yeah, it's me, my husband, and I have an elder child who is seven
Okay.
years old, and he's my second child. Raza is my second birth.
And how are you managing your finances? What do you and your husband do?
Yeah, my husband has a job in a bank, and I used to teach previously, but
Mm-hmm.
since Raza is born, I've been having issues with him, so it was really hard for me to join back.
Have you asked for any social or any financial aid from the government?
No.
Okay. And how has the disease impacted you, psychologically and
Yeah, I feel like my life has stopped for a while because there's always
mm-hmm.
something coming up. I was hoping that I would send him to nursery and maybe things would smoothen up. But now that he's having like this issue, and I
Okay.
don't know, we're already visiting a brain doctor, and already he has issues. So I don't know what comes up and how we're going to deal with this, how his education is going to be. So there are a lot of
Mm-hmm.
concerns right now.
Can you also tell me that about, I can understand your concern. I'm
Your
sure we're
times,
gonna, okay.
yeah, please summarize.
Today I got a chance to take history from Mrs. Mona, who's mother of 3-year-old Raza, who presented with complaints of not playing like other peers, which was noticed 3 months ago when he started nursery. He also has history of fits at the age of 1.5 years and some rash on the face. He has had some eye surgery as well, and he's wearing glass on the right side, and he's wearing glasses for that. He's a bit cranky right nowadays. He was born by emergency C-section due to fetal bradycardia. Was it had history of birth asphyxia and was admitted to for 1 to 2 days. He's on follow-up with the neurologist and ophthalmologist and some physiotherapist as well. His gross motor age is around 15 to 18 months, and his receptive age is around 2 to 2.5 years, and expressive is around 21 to 24 months. And the mother parents are significantly concerned about their well-being, and they want some support as well.
Okay, that was too fast. Okay, so what
Yeah.
teams did you say that they were following?
Neurologist, ophthalmologist, and physiotherapist.
Okay, your time for assessment has started. Please start assessment.
Okay, so I will wash my hands and take permission from Mrs. Mona. Mrs. Mona, can I play with Raza?
Yes, you can.
Okay. Did you notice when I entered?
Yes,
And what is he doing?
he's sitting on the floor.
Okay. How is his build?
He looks a bit small for his age, but he's not sick. Okay.
Okay. And any dysmorphic facial features?
There's a red rash on his face on the right side.
Okay. And any medical aids attached to him? Any glasses, hearing aids?
Yes, he has glasses on.
Okay. Does he understand English?
Yes.
Okay. So I'm going to ask Mrs. Mona. Mrs. Mona, is there any place which is hurting right now of Raza?
No.
Okay. So I will take crayon, tube, and plastic scissors, book bead, and a car, and I will go sit in front of Raza, and I will play with him. So I will give him crayon. Which hand is he? First of all, I will take the crayon. I will take the red cube, and I will check his eye alignment. Is the eye properly aligned?
Mm, he has um some squint in his right eye.
Okay. Um, and okay, then I will give the crayon to Raza. Which hand is he using it? Taking it from?
Right hand.
Good job, Raza. Can you please give it to transfer it to your left hand?
Yeah, he transferred to his left hand.
Okay, good job. And how is he holding it?
In the right hand, he is holding it with a palmar grasp,
Okay,
and
what about left?
yeah, and the left hand in the left hand is also holding it in palmar grasp.
Okay. And Raza, can you tell me what color is it? Hello?
He cannot color his.
Okay, okay. So, Raza, look at these cubes. There's so many cubes. Let's make a tower out of these, okay? So, see, I'm making a tower, one cube on top of the other. Can you make a tower? Is he making a tower?
Mm, yes, he can make a
Uh,
tower.
how many cubes tower is he making?
4 cubes.
Good job. And can you make a bridge?
No.
Okay. Good job, Raza. So I'm just going to take the cubes and I will bring a crayon for him. and I will give him a book. So Raza, see, I'm drawing a circle. Can you draw a circle?
Uh, he does circular scribble, but he cannot draw a proper circle.
Okay. Okay. If I draw a line, can he copy it?
Yes, he can draw a vertical line.
Okay. Good job. So, Raza, I see I'm drawing a line and I'm making a head. Can you make your mommy for me? Can you make a person from the
No.
okay. Very good. Good job, Raza. So I will take the crayon away and so Raza, look at this book. Can you please turn the pages of this book? Is he turning the pages?
Yes, he turns many pages at a time.
Okay. So and which hand is he using mostly?
Right hand.
Okay, good job, Raza. So, Mrs. Mona, I want to just assess with him using this plastic scissors. Can he handle it?
The mother says that he doesn't know how to use the scissors.
Okay, I will just, can I give it to him and I will teach him how to use it?
Okay.
Okay, so Raza, look at this. It's a plastic scissor. Can you hold it for me? How is he holding it?
Yeah, he's holding it with his right hand, but he doesn't know how to use it or how to use it, like how to handle it properly. He just picks it up in his hand.
Okay, is he using both hands to hold it or one hand only?
Or only in the right hand.
Okay, and if I hold a paper in front of him and I'll teach him this, Raza, see, this is how you cut. Can he cut pieces of paper or
No,
snibbling?
he
Uh,
tries to, but he is unable to do that.
okay, good job, Raza. So I will take the plastic scissors away from him and I will bring um, uh, beads and a string. So Raza, can you put these beads in the string and let's make a necklace for mommy?
No, he just holds the beads with the right hand. He cannot string the beads.
Okay, okay. Then I will take the beads away. And Raza, see, I'm holding this red car. Can you also pick up something like this from this toy bag?
He picks up a yellow card.
Okay, thank you very much, Raza. So I've done my assessment of fine motor.
Please tell.
Should I start?
Yes, yes.
Today I got a chance to play with a 3-year-old Raza, who appears to be small for his age. There's a rash on his face and he's wearing glasses. And there's a squint of his right eye as well. He noticed when I entered the room, and there's no dysmorphic facial features. And his during the eye alignment, his right eye had a squint, and he was holding the crayon in a palm grass in the right hand and left hand as well. He demonstrated making a tower of 4 cubes. According to my assessment, his age is around his age is around 21 to 24 months, because he demonstrated making a tower of cube of almost 4 cubes, but he did not demonstrate making a bridge. He could make circular scribbles and could copy a transverse line as well. He could hold the scissors with one hand, and but he could not make nibbles. He did not demonstrate making snippets from the paper. He was changing the pages of the book multiple pages at a time, and he did not demonstrate the use of beads or how to string beads in the necklace. And yeah, so according to my assessment, his age is around 21 to 24 months.
Okay. Okay. So what do you think is the cause of delay in this child?
And so keeping in view is delay. And I think this is a case of, in his clinical features, I think it's a case of Sturge-Weber syndrome. It can also be birth asphyxia because he had history of birth asphyxia as well.
So Sturge-Weber syndrome. So why would he has a delay in Sturge-Weber syndrome?
Because of the fits, he can have delay.
Okay. Any other feature that you asked for and that you thought that happened?
Any other feature that I?
Like, did you probe any other thing associated with Sturge-Weber that
Yeah, so
is
he has
fine motor?
history of he has history of fits, he has history of rash, and he has glaucoma surgery as well.
Okay. Okay. What other causes could there be?
It can also be due to birth asphyxia because he's a history of fetal bradycardia that could lead to fetal hypoxia and he also has history of birth asphyxia.
Okay. Okay. So how are his fits being managed?
He's taking medicine for that.
Will you ask for that? Okay. Last
Mm.
3 minutes. Okay. So how would you like to investigate?
How would I like to?
Investigate.
So first of all, I will take proper focus history, do developmental assessment of other domains of the development as well, take vitals and plot it on and check anthropometry and plot it on centiles and do review previous charts. So I will review the previous charts. If there's an MRI done or EEG done, I will look at those. Um, and I will involve my consultant pediatrician, a pediatric neurologist, pediatric ophthalmologist, dermatologist, and
So would you like to do any other investigation in this trial right now?
I will do, if he's taking drugs, I will do drug levels. Uh, uh, and
Okay.
I will
So
also, yeah.
considering his delay, how can you help the child?
So because he's delay at the fine motor, I will involve occupational therapist with him and physiotherapist as well.
Why would you need a physiotherapist? And why did actually the child did have some physiotherapy? Did you ask why?
No.
Okay. So what would be physiotherapist be doing in this child right now?
So, if there are any, because fit, if there's any hemiplegia, or he's not using any, because most cases can develop hemiplegia as well, stroke as well. So, physiotherapist will
Mm.
help with that.
Okay. So
Maybe he
what is
had
the
that
role
in
of
previously as well.
okay? What is the role of occupational therapist?
So they will make some home modifications and also help with day-to-day activities that he can do. They will support him.
Okay. So what else can you do for the child and the
I
family?
will So I will involve the social self services, take help, file a form for daily support so that they can have financial support as well, and involve an EHCP team. And yeah,
The child has the speech delay.
no mother said no. I did not ask about speech, but he could name.
Okay.
He could
What about
name
his behavior?
four body parts.
What about his social development?
The mother said he's a little bit cranky, more than usual.
Mm-hmm.
I did.
Okay. So how can you help the mother as she's really upset about all the things?
So first of all, I will counsel her regarding the condition, and
Mm.
then I will involve make a special educational plan and involve occupational therapy as well.
Okay. Time out. Is up. Thank you. Okay. Uh, time out. Sorry. Okay. So how do you feel after doing this?
Yeah, it was not very good.
Why would you think what went wrong?
I think I took a lot of time in the beginning because I did not have time for behavior. I did write it down, but I was
Mm,
about to ask it when you said the time's up. And yeah, I should have probed more on the fits and
mm,
physiotherapy as well.
mm. Yeah. Okay. So I'll take one feedback from the participants and then I'll start. So anyone from the participants, just please raise your hand if anyone wants to give any feedback, and then I'll unmute you. Dr. Tanushi, would you like to say anything?
Yeah, actually, this history was hovering around his play, so nothing much was asked regarding that. So we don't know whether the child had features of autism or any ADHD or anything else. Like nothing was asked. That is one point that I want to say. And rest, I think she asked a lot of close-ended questions, and maybe like where the answers are yes and no, yes and no. So that sometimes takes a lot of time. You can't go to the job that you're supposed to do.
Right. Okay, so one question that I have, why did you ask about the transfusions? Because that was one new question that I haven't ever come across in the development.
Because past history, it's a triple TIUA, so I was just completing that.
No, but why transfusion in development of a child, a spine motor delay? In fact, like I just answered that in a flow. I said no, but then I realized that maybe mother doesn't even know what's transfusion. Like if you haven't really properly told her, because that was totally, I think, out of the picture transfusion. Okay, so let's just discuss what did you do well and what were the things that would have been better. Okay, I think someone has mentioned. Okay, Doctor, I'll take another comment. I think Dr. Ikra, would you like to say anything? Dr. Ikra Yaz is here. She
Yes,
wants to
yes,
say.
yeah, sure.
Yes.
So first of all, she was really very quick. So it was very difficult to understand like what she is asking and what she is replying. Like she even calculated the speech age, but I was unable to like make it out. Like how did she calculate? And questions were not very peculiarly asked or like with a pause they should be asked. Like they are clear to the examiner and to the mother as well. Initially, empathy was good when she started, and then the screening questions were lacking. She just picked up that abnormal movement screening question, and there, if she found that it was fit, so she just completely jumped onto the next question. No compliance, no follow up. Why fits controlled or not, or with whom she is following, what were the fits like, or something. Their elaboration was needed. Okay, and then after like she was too quick, it was very difficult to like pick up where she went wrong. So even being fast, she missed a lot of things. I've written a lot of things. You don't have time for all of this to be discussed, but yeah, this is what I felt.
No, Dr. Ikra, please do tell me whatever you've written.
Yeah. So okay,
Yeah,
so
better
let's
you
just
than
discuss one by
examiner.
one. Yeah, that happens because that's why I asked you guys to listen, because you see, when I'm being the role player, I did obviously pointed out some things, but a third person who is just listening to the two people there, he could like apprehend better that what's going wrong. So yeah, you were fast, one thing. And again, that like Dr. Ikra is right that with the fast pace, even a few things were missed. So how can we make it better? Initially, similarly, as you said, that like I written, the first thing I write down was good communication, because initially it was good, like things were better. Then after that, like there was some issue regarding when you ask that. So the initial questions were right. When did you notice that? How did you notice that? Okay. So fits, you see, in the it's in the development, it's a focus neurodevelopmental history. So something whenever comes, yes, you have to prove that down. So your questions were a bit vague when you asked about fever. So I was not, because you see, you were fast in asking questions. So I think 2 or 3 times I had to ask you again that what exactly are you trying, because your question was not very clear regarding the fever. So I told you that the child has been having fits since 1.5 years. And then you asked about the fever, and I was unsure that what point. So maybe you could have asked in a way that, I'm so sorry to hear that. So can you please tell that when were the first fit started? Did he have any fever at that time? Was he admitted, or any blood test or any other test was done at that time? Was there any diagnosis given to you to realize that was it actually the part of disease? Like, yes, you did find out that it was Sturge-Weber, but did you find out that that at that point, because a child of Sturge-Weber could have had a meningitis, and this could have been a post-meningitic sequelae, right? So what happened when you find a history of a cut point, then you have to probe around that, that what happened before that event. Like, was there any fit fever? What happened during? Like, what treatment was being given? If you would have, I would have told you that there was no fit and it was this one, and the doctor said it's a part, maybe it's a part of his disease. And then how did it go? So if you would have asked me, I would have told you that initially, for the initial 1 year, the fits were really difficult to control, and he had to be given 1, 2, 3 medicines. And now for the last 3 to 4 months, his fits are being settled. So you would have an idea that due to recurrent fits, because he's having some brain issue, he's having some like atrophy or something like that, because it's a Sturge-Weber syndrome, and in that the fits are like difficult to control. So the details of that was really, really important. So I don't think details of fits were there, detail of medicines were there. In the end, you asked me that what teams he's following, but at that very point, the details of that very thing was important to ask. So I think that was totally skipped. After that, you went to the birth history, and then the birth history, things were fast about the drug, about the smoking. You were saying the words, I'm sorry now, but they were not like really in an empathetic tone that should have been. Like when you ask about drugs or smoking, you need to say that like you need to like show it in a way that you actually mean. You don't want to ask a certain question, you just have to ask that. Then you have, I think, this one particular phrase that's like, you say that's great a lot. I think I wrote it down. You, in the 9 minutes, you said this word, that's great, I think 7 to 8 times, because I think probably that's your reflex. Once I answered you something, you said that's great. So I think that doesn't look nice on everything. Like I'm telling you something maybe not very good, and then you are replying it to me, that's great. So I wrote it down that you at least like 6 to 7 times you said this phrase. Like everyone has someone, like I personally, I say you know a lot. So everyone has one of the pet sentences, but I think that doesn't look nice when you are taking a history or maybe something in which the mother is upset or something and you're saying that's great. So that doesn't sounded very nice, right? So after the
Okay.
you had some ideas in the beginning. I told you that he does walk, but he doesn't walk fine. So maybe you could have asked in like a bit of a detail that like what kind of walk or what difficulty is he having, because I was continuously trying to point you out towards the hemiplegia, or at least hemiparesis, walkness, weakness of one side of the body, right? But I don't think you were able to do that. Maybe you had that in your mind, but you did not.
I
Maybe
asked
you
that
could
in
have,
assessment.
yeah. Y- okay, we'll come to the assessment. We're just discussing the history. So maybe in the
Okay.
history, when you said about the gross motor, so maybe you could have had that things in your mind. I think regarding the speech, again, as I told you, the things were a bit quick. So when you ask that, is he able to do the two-step comma or something? This looks very, very like straightforward. The mother might understand that, mother might not understand that. So you need to clarify your questions a bit. Then you asked me, I forgot, maybe I think I wrote it down. So there were things, yeah. So you asked me, is he like his peers in walking, talking, and things? So you asked me 3 questions at one time, right? Had I said yes or no to one of the other things, you would have been confused. So when you ask one question, try not to ask 3 to 4 questions at one time. I still think like you ask, how is he like his peers in walking, talking, and there was another word when you used like this. So regarding the speech, I think you asked that how many body points can he body parts can he tell, sentences can he speak, I think around the social. So you see, when the child, again, the Dr. Anushi that said mentioned that I was said that like had a journal sentence that there was some issue with the play. So it could have been autism. The child with the syndromes could have any feature of the autisms. So it should be ruled out, like in 1 to 2 questions, right? How is his interaction?
Okay.
What kind of play does he do? Is he like toilet trained or not? About the feeding. So the social history, I think it was lacking. Maybe you said that the time went up and you were not able to ask. So the extra questions that you said, like transfusion, trauma, I don't think it was very necessary. You see, you ask these kind of questions when you don't get a typical direct cause of issue, like exact issue, what's wrong with the child. Like maybe there's a child in the development in which you are unable to find one specific cause, and you have to move around and ask about different things to find out a cause. But in a scenario in which there's a typical, like, straightforward case that the child has this rash and has fits and has like issues, so why would you go asking about trauma? Like, there was no significant of that. Would trauma had given you any, because I think you because you asked about trauma and I was confused, and then I asked you what trauma at what time. I think there are like 15 to 20 seconds were wasted on that, right? So similarly,
Yeah.
yeah, so these are the time, these are the minutes, or these are the seconds that you could have saved. Then in the development social history, I think it was okay about the family history, about of that you did ask about the impact and all of that, so that was fine. So whenever we're taking the history, you mainly have to focus on the four things. First, your first thing is to determine your cause of the disease, of the, like, of the delay, right? So when you found out about the rash, maybe one or like two questions about the rash or something, and then you had the answer to, like, the child, because this is one of the scenarios in which the child exactly had the similar things about the rash, about the fits, about this eye surgery, all of that. Okay, so maybe you could have added what point, what age the eye surgery was done, and like how is it doing now, something. So what the points which come out to be positive, you have to maybe ask one or two questions about them rather than asking completely out of the way questions. So your first task in development is to find out the cause. It's your good luck. I always say it's your luck and then good luck if the cause comes out in front of you in first a minute or so, right? So you're very lucky, because at times if you're unable to find the cause, then by the end you are just confused like how to find the cause. So it's good if you find a cause right away regarding a syndrome, or maybe in the like antenatal natal history, if you find a cause which is directly there, it's a luck, I would say. Your second thing is to have an idea of the other developmental domains. That's very important, so I think you should not miss that. Maybe if you would have simply missed if the other, like medicine or something, that could have been forgiven, but about the domains, the other three domains have to be done in a proper complete detailed way, right? So plus another thing, why your time was wasted, because you spent a lot of time on the gross motor. So if a child is not able to run properly, why would you ask that he can like walk backwards? I don't think that needed to be asked. Then about the stairs, when I told you that like up or not, no, he's not going up or down properly, it's fine. You see, you just have to have an idea. If it had been in your assessment part, then definitely you have to ask about each and every detail, one, two, three. So in the history, when you're asking, I think two questions per domain are more than enough. You spent a lot of time on asking the questions of the gross motor, which cut your time of the other domain, right? So if you would have asked, can he walk? I said yes, but not properly. Can he run? Not properly, right? So maybe another one other question and that's it. And just stop it right there, right? Don't ask like going
Okay.
on about things. Similarly, in the receptive and expressive, you ask, I think, two things about, okay, yeah, another question that I asked that I forgot. You asked that can he tell his name, age, and sex and gender. You said three things at one time, right? And I
Hmm.
said no to all of these. So you don't ask that. You have to ask things step, because all of these things does not come at one age, right? So you need to ask one thing that is age specific. Can he tell his full name, right? If yes, then move forward. If no, then move backward. Okay. So that's how
Okay.
you can save your time. Write down two questions which are very particular, pertinent to those domains, which will give you an idea either the child is delayed or not. So in the history, it's good that you exactly point out that the child, what age the child has in, like in this specific case, it's good that you found out that he has this age in the like in the gross motor, or this age in the hearing, speech, and everything. But it's fine if you just have an idea that either the child is normal or delayed. That would be enough as well, right? So that your aim should be that I have to at least find out that is it delayed or not. And if the history is going well and you have enough amount of time, you can like ask more question and typically find out that what age is of that. Okay. So second part is your
Okay.
development, as I said. Your third is your random questions, like about the teams, about overall management. This is the part which I think could be like shortened or expanded depending upon how much your time is. And your fourth part is your social, which is really, really important. So 1, 2, and your fourth part is really important. The third part, which is your extra questions, which could be relevant according to that case. Like if there's a case of hypothyroidism, maybe ask about other diseases. There's a case of syndrome, you maybe ask about diseases. So these are the things that could have that could squeezed, or that could be expanded depending upon what your history is and how much time do you have, right? So this was about the
Okay.
history. Regarding your summary, I think your summary was good, but it was way too fast for me to understand. Like I am someone who has a I speak fast as well, and I am used to hearing like fast things. But for this exam, I would suggest you to slow down your pace. Okay, so I know
They say you have
we
to say it
have,
in 1 minute, so that's why
yeah,
I
and you
started saying
completed
it,
it in
you know.
50 seconds. So you still had 10 seconds to go. So what happens is
Okay.
that, yes, your aim should be to complete it in 1 minute. Maybe you can take 5 to 10 seconds more. You should like, because you see, you could, how could you make that better? Not to tell ages of everything, so that he has
Okay.
age of this and this one and that. So you could say that he is delayed in gross motor, speech and hearing, and social as well, right? So that could have been better. So that's how you can say it. So I don't think, if you could just, I'm not saying that slow down a lot and take a lot of time, but I think
Mm-hmm.
speaking a little slow wouldn't hurt, and it wouldn't take a lot of extra time. So after, even after the bell, like 1 minute is gone, the next time is yours. So I wouldn't say that if the 1 minute is there, they don't say you to just shut your mouth at that point of time, right? So they'll tell
Okay.
you that your
Okay.
assessment time is started, and you can briefly summarize your point, like thing at that time. Okay. So I think maybe you can just record this again today and listen to you. Like even if the recording of this is available, I would really
Yeah.
ask you to revisit that, so that you know that what I'm saying, and you are able to like identify what flaw like did we here. I think your assessment
Okay.
was really good. That I really liked. Your initial style was really fine of how what the child is doing. Does he notice me? That I think you, for the autism purpose, you ruled that out about the hearing thing. And then okay, again in the history, I remember you asked about the head. Is it big? Is it small? I don't think that needed to be asked a lot in the history. Once you have got the hint that the child has the Sturge-Weber syndrome, right? So I,
Okay.
again, you see, I think this question took a time as well, because what about his head? And I was like, what about head? And then you said, was it big? Was it small? What did the GP said? So again, it took around 10 to 15 seconds. So that could have been saved as well. Okay. So
Okay.
these are the questions that you ask when you don't find a typical cause. When you have found the cause, then what difference did it make if I tell you that he has a small head? Like maybe you could have asked that in your assessment, and you did ask about that in the assessment, right? That any
Okay.
dysmorphic
Okay.
features, like his growth parameters and all of those things. So that thing went fine in the assessment. I think your journal looked wise thing that was okay. About hearing thing was okay. I think you came down at the level of the eye. You took look for the eye alignment, that was okay as well. Regarding the cubes, so yeah, I think in one thing you said that I'll ask what the color is. We don't ask about the color in this one, because asking about the color comes in your speech and language in this one. But the I
Oh,
think at the end you ask about the matching of the colors. That was the right thing to do in the vision and fine motor, right? And
okay.
in the
Okay.
very beginning you ask about what color is this, can he tell? So I said no, he cannot tell. So that comes in your expressive language, right?
Okay.
So
Okay.
after that, I think maybe you were able to, like, you did maybe identify that there's some weakness on the left side, but I think it didn't came out to be very clear in matter that you would not like. It wasn't very clear that you were actually telling it, or you made it
Okay.
clear during your examination. So I think every time things would be there, you should be comparing both of the sides. Once you have had an idea that both
Mm-hmm.
things are there, and then when you're telling it in your assessment, I don't think you specifically mention it differently that there's some issue with the left side typically, right?
Yeah,
So
I didn't
this,
mention it
yeah, so that has to
because
be
he was
mentioned.
holding it as a palmar grass in both the hands, so that's why.
Yeah, but he wasn't not using it, he was just holding it, right? He wasn't actively
Okay.
using it. So
Okay.
you could have asked that in the history, right? Or maybe you can in the assessment, that is he like using, because when the child builds a cube, he can use both the
Mm-hmm.
hands in that, right? Or when the child is like,
Okay.
when I tell specifically, it is said that regarding the scissor, early the child would hold scissor in both hands if he's young, but he was not holding that, right? So I think it
Mm.
had it, you did like had an idea. I think you did get to that, but to make it obvious and make sure, it needed to be told, right? In this one, you could have said
Okay.
that like it could have been that the child is like having the right sided, like he does things with the right hand, but in the when we're doing the fine motor, and you it could have been like the other way around, that the child had a weakness of the right hand and he was using left hand to do the things, right? But some kind of weakness was there, because I tried to tell that in the walk. I tried to tell that because he was having the issue rash on the right side, surgery on the right side, so he had the right sided brain issue, and then due to that there was weakness on the left side of the body, so it was there. Okay, had it been a
Okay.
case in which the gross and fine both were to be assessed, because that can come as well, so maybe you
Yeah.
could have like picked it out and things could have told in a better way. Again, I think
Okay.
it had to be given a bit of an importance and told in a good way, right? So further, I think your cubes are okay, your circling things was okay. I think the pattern of the tech thing was okay. That was fine. Um, if the child is making the like it's fine if the child is making the tower of 4 cubes. It was okay that you asked about the bridge. That was fine. After that, I think when you told the assessment, when we are giving the age after the age of 1 year, I think giving a margin of 6 months is more appropriate. We give the margin of 3 months below 12 years of age, like we say that 6 to 9 months maybe, or 3 to 6 months, or 9 to 12 months after 1 year. I think it looks better that you tell it said like he has age of 18 months to 24 months. I think I haven't heard much saying 21 to 24. That's pretty much close. You can't really say it. He could have had some things of 18 months. So I think giving an age of 6 months would have been more appropriate rather than
Yeah,
targeting.
Dr. Iqra, that's also difficult for me, but I read it in Mark BT that below 2 years you have to give of 3 months. That's why, because if I knew.
No, like I think in journal practice and the journal exams, like what we have done in given in our exams, below 12 years, 3 months is more like is more required. Okay,
Okay.
at times they use it at 12 to 15, 15 to 10, but I don't think I have like listened or heard 21 to 24 months. I'm
Okay.
not sure, so maybe below 18 months, but after that I think it would have been better. It looks better, it sounds better telling it 18 months to 24 months. That's fine.
Yeah, yeah, it
Okay,
does.
yeah, so 6 months, it's a safe space for you as well, because some things would be of 18 months, some things would be of 24 months, so it's a safe place for you as well. So safe play to do that. So I think that would be better. It would ease you out as well.
Yeah.
Regarding the causes, yes, it was Sturge-Weber syndrome. It was clear. Thing was having issues. Regarding the investigations, when I ask you, I think you need to be a bit clear that, like, obviously you'll review the previous things and see if anything has to be done. Maybe you can go for the ophthalmology assessment right now, or the drug levels if the child is taking. I think in the management thing had to be a bit clear. Uh, because obviously you have a flow of things. I'm pretty sure that you have like read a lot and you have all the knowledge and everything, but you need to be like clear that what am I going to say and why am I saying that, like depending upon that child. So in this issue, obviously, the issues are of the fine motor, and you have to have
Mm-hmm.
the occupational therapist. Yes, physiotherapist again is required because the child has hemiplegia, but did not mention it in your history or in your examination. So that's why I asked that why
Okay.
have you mentioned that? Okay, so because it was myth, but the child did need physiotherapy. Uh, the child did need occupational therapist to have like the learning the basic skills or the daily like skills of the life. Other than that, obviously the child is a bit delayed as well, because the child is unable to like speak sentences, is only able to speak few words. I think you got confused at the end when I was asked, like started asking you. You did ask that the child is delayed in speech, and obviously the child would need some speech therapy as well. Other than
Mm-hmm.
that, the child like obviously has fits. He needs to be like on the regular follow of a neurologist and all of that. Regarding the social, you need to bring it up on your own, that like what help can you do to the parents. And so you see, I think in development the things are very much the same. There's no much science that you're going to say that there's some difference coming up. So more or less the teams are the same. You just have to prioritize. You just have to be careful. What do you have to say? Because whatever you're going to say, there's going to be cross questioning regarding that. So you just have to be clear regarding that, but that what comes out of your mouth and what do you mean by that? That's it. That is the thing that you have to take care of. Right. Other than that, I think the things are pretty much the same. They don't change. You know that the roles of, you need to know the roles of physiotherapist, occupational therapist, every therapist, you need to know about that. You need to know about the educational issues that the parents could have, the social issues that could have. So the things, the questions, the answers are pretty much the same. You just need to be clear, and that comes when you speak mindfully, right? Rather than just saying whatever comes in your mind. So that's that's the whole review of what I wanted to say. Okay, Dr. Iqra, just wait a second. I think we have a few questions. So Dr. Amir is asking, do we have to tell the domains of the development that we took in history in the history summarization part of the complete assessment? So Dr. Amir, when you take the history, like if you take the example of this case, we had to do the fine motor assessment. So you would not ask any question regarding the fine motor in your history. You would ask about the gross motor, speech, like hearing, speech, and the social in your history, and you're going to tell about these three in your history summarization. And after that, once you do the fine motor assessment, then after that you can say that either the child is global developmental delay or has an isolated delay, right? We have another question. Dr. Sadaf is asking, are we allowed to write while performing developmental assessment? Like what task the child does? Because I guess I will forget the task. Okay. So Dr. Sadaf, you are allowed to do that, but personally, I think you won't be able to do that because it's not something that you ask and then you write down and then you ask. That doesn't give a good impression. You have to be fluent in that because you see, it's the narration of what you're doing. Imagine that you're in a clinic and there's a child that you are doing a developmental assessment on. So you wouldn't be like assessing the child and then taking a break and writing things down and then coming to the next task. So you have to practice this. You have to make your reflexes. If you think that you won't be able to memorize or remember that, then you have to keep repeating, keep doing the practices as much as you can, because it's not recommended that you write things down. It won't be any help. It would cause you like maybe cause a negative impression that you're writing things down. So you have to make practice of this, that you practice so well of hearing things. So you see the multiple tasks that you are doing. So one thing is that you are saying the commands, you are telling what to do. And the second thing is that you're listening to what the child is doing. And the third thing is that you're comprehending and you are analyzing it, that whatever is being told, what age is this being fitted into, right? So I know there's a lot of multitasking going on at this time, but it's not as bad as it looks. When you are in the flow, and for that, the first thing that you need to remember, like do, is memorize the charts, like the developmental milestones. If you have a good practice, if you have a good memorization, if all the milestones, everything is in your on your fingertips, then it would be really easy. Things would just come out in a flow in front of you, right? So first thing for the development, I always say, is that keep looking at the developmental charts wherever you're doing the milestones from. Keep looking at them, keep remembering them. Then whenever you have a free time, make up in your mind, like if you're sitting idle, you have 5 minutes, just keep revise in your mind that what a 3-year-old child is able to do. So make a list of all those things that a 3-year-old child would be able to do. Or if like in this case the age is 1.5 to 2 years, so make a list in your mind that all the things, all the fine motor tasks that up like 18 months to 4 months child can do, right? So this is how you will have all those ideas that how the child is performing, right? Okay. So
Dr. Iqra,
yeah.
yeah, you said that what will be the management? So we are already giving medicine for the fits, right? And
Yeah.
other than occupation and physio, what else should I have said?
So it would be physiotherapist, occupational therapist, speech therapist, then the social issues of the parents, the counseling, the social support. Maybe the mother is really upset about the thing, so
Okay.
some help regarding that. Mother is upset about the education of the child, so you will help them regarding that. Okay, so the time
Okay.
is like this. You have hardly 1 to 1.5 minutes about the
Okay.
management. And when you're
Okay.
telling this management, you're going to tell this, and in between these, the examiner asks the cross questions. Like usually they ask, what is the role of this, what is the role of this, what is the role of this, and like maybe they can ask one or two other things in the cross questioning, right? So the management is
Okay.
basically this. So, Dr.
Okay.
Zuleha Zuhail, are we allowed to make notes during the history part of it? Yes, you are allowed to make notes in the history part of it, but you have to be careful that it should be your reflex as well, that you need to have a continuous eye-to-eye contact with the role player. So you are having a good conversation with the role player, and in between, just for maybe a second or so, you can just write down important points. So it's recommended to maybe just write a few words or something, that you can go through that if when you are done with the history, not a lot of things, right? So that's again is a thing that you have to practice, that you have to have a continuous eye contact and a continuous communication with the role player, and in between your hands should be trained that they could write down on the paper, like without you looking at the paper, right? So it should be your reflex. Dr. Karishma is asking, you told that there are 4 parts in the development history: find the cause, idea about the other developmental domains, journal questions, and the fourth one is the social part, about the family, about the impact of the all of this on the parents, on the child. So the social part of it. Dr. Ikra, you had some questions you mentioned.
Yeah, yeah, thank you. I wanted to extend the question of Dr. Amir. He said that you have to establish the delay in other domains, like the one which is has not been asked for assessment. So we just have to establish the delay, or how much it is delayed in terms of age, that we have to calculate. Because I will simply ask one question or two questions, then I'll get to know that this is delayed, isn't it?
Yeah. Yeah. So Dr. Ikra, you see, it's important that you find out the delay, right? That's the core part. You have to rule that. You have to establish that for
I have to
sure.
come up with the age,
Yeah.
developmental delay in
That
terms of age,
depends.
or just the
Yeah,
delay.
that is not a confirmed thing, right? Like in a sense that personally I think that depends on your overall history. It's good if you
Okay.
do that. If you have
Yeah.
good amount of time, if you think that you will be able to summarize things up and you have time for all of the things, then it's good. But I still think, I always, like personally, even me, and whenever I tell to the other candidate, 2 questions per domain are good enough to find out the delay and the age as well, right? So it's not that you're not going to tell exact age. This is not a detailed assessment. So we're not expecting, the exam is not expecting you to tell exact age. Most of the what from the reviews that I've like taken from this, in most of the cases, the examiners are happy about the fact that you have established that there is delay or not, right? In a very few cases, they might ask about that, what, like how much delay is that, and what's the age. Even if they do ask, they're not looking for a pinpoint age. You just have to have an idea, right? For this one, like in this case, asking about the, like, is the child able to walk? Yes. Is the child able to run? Not properly. I think if that would have established that if the child is not running properly, it means that the child is not above 2 years of age. So he's around maybe 18 to 24. Then in the expressive, like you could ask about the name and the, like the number of words that he can say or the sentences. And in the receptive, she did ask about the command and the body part. So that goes for the 2 and 2. And then for the social, you could ask about the toilet training, about the spoon or the cup usage, or about the play, that kind of play. So 2 questions per domain is fine. It will tell you either the delay is there or not. And even if the delay, it would give you a rough idea of the age. So I think that would be fine. If you
Okay.
think that in one or thing you're not very clear, you obviously can go for another question, but make sure that does not like it does not cut the time for other things that are more
Ma'am,
important.
there's a question. There's a question.
Yes.
Like in the if you're asked to do both the gross and fine, okay, in your assessment together,
Yes.
and
Yes.
while you are doing your fine motor, you have reached your age. You are very sure you have done the crayon cubes, maybe one or two more. And is it necessary to complete 3C, 3B, all of them for fine motor, and then go to gross
No.
motor?
No, if you have if you have to assess 2 domains, then obviously you have to balance the time, right? So you could skip a thing or two.
Yeah, that is what some of the
Yeah.
mentors have said, that you
Yeah,
need to
because
complete all. So that was my
yeah,
question. Sometimes
yeah.
the
So
time.
you see, yeah, so if there's a 2 tasks, you see, because always you have to have things that could, so you see, so what happens is that you have 9 minutes. So today when Dr. Rahman was taking the assessment, I think she completed the assessment in 6 minutes, right? So I think that if she had to do the gross motor as well, she would have taken like maybe 2 minutes more. So she could have completed that. It totally depends on how the things go on. So there are cases like there have been recently, there have been some cases in which the child had features of autism and they had asked you to assess the fine motor. And in those cases, it was really hard to do the fine motor because child was not responding and it took a lot of time to just like assess that very thing. So it depends on case to case. And there are times when the candidate does things, it depends on the examiner as well, how fast the examiner is telling you. Because you see, every examiner, he does not remember all the things by heart. So I still remember when I was giving the exam, I think in my development station, there was an Egyptian examiner, and they have usually a paper, like a set of paper stapled together, and when you ask a question, they like turn the pages up and down and they see that where is that question written, and then they tell you the answer. So it depends on how fast the examiner is telling you and what time do you have, right? So it all depends on how much do you have. You do have to do things. If you have a good pace and you are able to complete that well and good, if not, then whatever is being able to done, whatever you have done. But usually I've seen people like completing the things, right? In the double task, you have to be more directed and more focused, and like you can squeeze thing in that case.
Dr. Ikra, one more question, sorry. Why this is not tuberous sclerosis if we want to make it like that? So what are the points against that?
What are the points favoring that?
Favoring is developmental delay, history of fits, history of a rash. They also have rash, but they have generally symmetrical rash. And yeah, we could just see the face. You said that it is right-sided rash and the right-sided squint. So they also have squint, not very typical glaucoma, but they have some eye problems as well. So what
Okay,
was
so what thing could have helped in this one is to have a little bit of an idea of what the type of rash. Okay.
yeah,
So if she would have asked me about it, like what kind of rash exactly is there, I would have told it's a pink colored rash on the face around the eye, right?
okay.
And which was associated with that. Okay. So regarding the tuberous sclerosis, if you think there is something like there's some other, if in the tuberous sclerosis, you're right, because that's a part of your neurocutaneous syndrome as well. You can definitely bring that up here. But this specific case of having a rash, and which was typical here with the glaucoma, that it's more typical of Sturge-Weber. If the examiner say that could it be something else, then maybe you could give some other thing of like some other neurocutaneous syndrome or some other than that. But I think this is typically was of Sturge-Weber.
Okay, okay. Thanks.
Okay, so someone is asking, did we address the developmental assessment questions to the examiner in a formal way, or the patient-parent like interaction with the child? Yes, you should act like you are asking and doing it with the child. Do not ask the examiner that can the child do this, can the child do this. So the style of Dr. Rahman was really good because she was praising the child in between. She was asking that can the child do that. If you ask the question directly uh, from the examiner in a formal way, like can the child do this, can the child do this, it looks like that it's a questionnaire that you are filling. It's just like that you're asking the history, it's not the assessment. So you have to tell these things, that like she said that I'll take these toys and then I will give that, and then she like complimented the child and she that I'll take this away and then I'll give that. So you have to act it out, right, the way you are doing it, not just answering like asking it in a way a questionnaire is being asked. Okay, so the Dr. Karishma is asking a child 3 years of age. So should we start asking about the developmental history questions of 3 years and go back? Yes. So whatever the exact age of the child is, you have to ask, is the child able to do the age specific task? If yes, then you have to move forward. If no, then you have to move backward. Okay, so do we have any other questions?
Dr. Ikra, one more, sorry. I have a
Sure.
question from Dr. Rahman. She said that the developmental age, fine motor developmental age is like 21 to 24 months, she said, or like that.
Yes.
Yeah,
Yeah.
yeah.
So it was 1.5 to 2 years, according to the question you asked. Why did you calculate this one? Can you explain that so that I
Yeah,
also have?
because I read it in the MRCPCH that under 2 years you have to explain it in 3 months gap. So that's why I did it. I said it 21 to 24. Otherwise, I would have said 18 to
It was
24
less
months.
than 2 years. Na? She could not even hold the scissors properly, and snibbing comes after that, like 2.5. So she could not do that, and she could make a tower of 4 cubes. So this is
She had,
around
because
1.5.
she just
No, no, no.
like she felt
She
like
could.
telling it in the 3 months. That's why I think she said it. The thing were more towards like maybe two. But I think, as I told earlier, that telling a 6 month gap is a safe option. And next time, whenever you like have, I think just tell the age range of 6 months. That would be better for you as well.
So Dr.
Okay.
Ikra, both are
And
correct. Like 1.5 to 2 is also correct, and whatever she told is also correct.
No,
Like
I
that.
said that it's no. I said that like in this age, 18 months to 24 months would be the right option.
Okay, okay. Thanks.
Okay, so if you don't have any other questions, then I think like any other questions regarding development, we can have another
Dr.
5 minutes
Ikra,
if
if you're being a very strict examiner, then how much would you score me? Being a very
mm,
strict one, so that I know the minimum I can get.
Okay, so for the history, maybe I would give an 8 out of 12 or 8 out of 12 for the whole
Okay.
thing.
Okay.
Yeah. So you see, I tell you that it's not like I'm telling you that you have done some major what to be for, and what is that you need to aim for 100%, and then if you
Mm-hmm.
like maybe 20%, okay, the thing you should that
Sorry, I can't hear you.
yeah, so I'm really happy about your assessment. The speed thing that
Okay,
I'm
thank
telling
you.
you is not that it's going to give you marks, a lot of marks.
Mm-hmm.
I don't understand what.
Sorry, Dr. Ikra, I can't hear you. Is it only me or
Sorry, I think that's a connection. Able to hear me?
I can't hear you? It's a very
Just a second.
yeah, the voice
Iqra,
is breaking.
it's breaking.
Is it better now?
Yeah,
Yeah.
it is.
Okay, yeah, sorry, maybe there was some net. Okay, so I said that the things that I've told you, it's not like that what I'm telling you that you have a fast pace or things that this is going to cut you marks typically.
Mm,
But the thing is
okay.
that it's preferred, and it could make the things better for you, and maybe like make it more like appropriate, because you see, you can have an examiner who doesn't understand what the speed you're saying, but you may have an examiner who doesn't. So it's better to practice that. Your
Okay.
assessment is really good. I would tell you what to do is to have a good practice of history and try to complete that and tell management in a good way. Your assessment part
Okay.
was, I think, more or less perfect.
Okay. Thank you.
Okay.
The thing is, then when I get anxious, I start speaking I'm
I
speaking
understand that.
normally, but when I
I
get anxious, it's
understand
just
that. I
yeah,
am one of those persons who can speak very fast. And for this specific exam, I had to slow myself down. So I totally relate to you. But I think these are the small things that we can work on to make our overall presentation
yeah.
and overall thing better. Because you see, when we're in a hurry now, so what happens is that your communication skill and your connection with the role player gets lost. So the empathy
Mm-hmm.
factor in between gets lost somewhere. So that's what
Okay.
causes the issue at that point of time, right? So you are doing things right. You are saying things
Yeah.
right. Like you are commenting, you are saying that you're sorry, you are saying that, like, I understand, but it doesn't feel like that you are meaning all of that. So when you are slow and when
Yeah.
you're empathetic, like when you're slow, you are telling things in a calmer way and having a bit of like variation in your voice tone, that does help you out overall in your communication skills and all. Because see, when in the development station, two of your marks is about how you like listen to the concerns, how you make po and everything. So all of those things are being marked.
Okay.
Okay, so anyone else, any comments? I hope the session was useful and you get to have some good points from here. So thank you, Dr. Iman, for volunteering. I hope it helped you, the feedback and all, and it will
Yeah, I
be
did.
able, like, it will help you in your exam. So best of luck for all of those who are preparing for the exam. We have
Thank you
our
so much.
like group as well. I think at times we get inactive on the group, but I'll try to be more active on the group and I'll try to ask any quiz. So after today's session, if any one of you hear it later on and if you come to have any other questions regarding development, history, assessment, any of those things, then feel free to ask in our group as well, and I'll be happy to answer. Any feedbacks, anything, or if not, then I think we'll just sign up off for today. Thank you so much, Dr. Zuleha, Dr. Karishma. Thank you so much. Best of luck for everyone who's preparing. Lots of wishes for you.
Thank you, ma'am.
And thank you so much. Have a good night, everyone.